I am Dr. Katherine Teisinger, acupuncture physician, and soon to be Doctor of Acupuncture and Oriental Medicine, here to present my capstone presentation on cold foods and drinks may harm the digestive system. Now, our bodies are 98.6, so we are one giant chemical reaction, and when we consume foods that are colder than 98.6, especially 60 degrees colder, like when we do iced beverages, then we mess up the chemical reaction that is our body. Because basically, the human body is one giant chemical reaction. And if you throw any one thing off, you're going to have problems in the digestive system, because basically it needs to function at 98.6. The funny thing is that America is the first country ever to consume ice on a regular basis. We've been doing this since the 1800s. And the funny thing is that Americans have really no concept of how bad they're hurting their health every single day by consuming the amount of ice that they do. But unfortunately, that's something that we Americans do. And when I have patients that come into my clinic and they have sinuses or digestive issue problems or bowel issues, I always tell them, no ice. And they look at me like I've lost my mind. I mean, what? Ice? Of course I do ice. Like, no, you don't do ice. In fact, our panel here has nice ice in front of them, ice cold water. And I tell my patients, instead of drinking that ice cold water, I invite you to pour it down in front of you. What is your body's reaction? It hurts. Most people scream like a little girl. So what we are doing is, when we are drinking that ice cold water, you are shocking your thyroid, your thalamus, you are constricting your esophagus, and you are shutting down your stomach function. And even worse, you have that delicate little organ called the pancreas. And the pancreas does not like cold. So you shock it, and in my personal opinion, it hasn't been proven yet, I've never seen a study on it, I feel that ice is a contributing factor to adult diabetes, and that's one of the reasons why we have so many adult diabetics in America. In consuming ice, one of the things that you are doing to your body is you're actually causing hypothermia from the inside out. Because after all, this body is 98.6, and if you were to drop it in ice cold water, 54 degrees I believe it is, which really technically isn't ice cold water, but you will be dead in 10 to 15 minutes because you drop your core temperature. In the treatise on cold damage, written by Zhong Jing in the year 220. I had to really practice saying that, because 2020, 220. And of course, this treatise on cold damage is actually his own experience as well as information he had gathered. And I found it very interesting that cold, of course, is one of the pathogenic cheese, or the evil cheese, in Chinese medicine. And in reading this book, I noticed that it never occurred to me, even though I've been doing this for almost 20 years, that Chinese medicine was, of course, 2,500 years old, but it never occurred to me how they came about the science behind the Chinese medicine we still use today. And that is, they use the science of the times. And that had never occurred to me. I mean, if you don't know about a microscope or the atom or any of that, you use the science that you see around you. And this is why I believe that one of the reasons why Chinese medicine still works today. And that is because they linked our bodies with nature. They noticed it was dry, and they noticed it was wet, and they noticed it was cold, and they noticed it was hot. And they created Chinese medicine according to the science that they had at the time, which is Mother Nature. And the interesting thing is, it still works today because the laws of nature still apply to us today. And of course, this is the 5-element theory, which I have not been trained in, but it still was very fascinating to me. And then, of course, I was trained in the zone 4 organ. Now, I did find it very interesting when I found this, this ancient drawing, is, of course, you know that we have paired organs. And today we're going to be dealing with the spleen and stomach. And you see the ancient drawing of the stomach, and then you see the ancient drawing of the spleen. Doesn't that look like a pancreas to you? So I thought that was very interesting. And of course, in Chinese medicine, the stomach and the spleen are in charge of transforming and transporting the food that you eat to the human body. That's its main job. And of course, the ancients also discovered that yin and yang balance, because everything has an opposite. Positive, negative, sun and the moon, dry and hot. And the goal of good health is balance. When you're out of balance, sometimes you need hot or cold to bring you back to balance. And in describing this a little bit better, I like to use analogies because when I'm talking to my patients, they have no idea what I'm talking about when I say, you're spleen yang deficient because you have teeth prints in your tongue. Well, basically I'm speaking a different language to them and they don't understand what I've just said to them. So instead I use little stories. And this one is about the cold syndrome. I tell them that basically their stomach or their spleen is like a pot of soup. And their stomach is the fire under the soup. And when you've got it boiling at 98, 99 degrees, and then you add ice cold water, or ice cream, or a frozen beverage like a popsicle or a smoothie. Smoothies are extremely popular right now. And all of a sudden that pot isn't boiling anymore. So what happens is, of course, the stomach's got to boost and use a lot of energy, a lot of firewood to make that pot of soup boil again. And now it's boiling again, but the older you are, the more energy it takes. And so therefore, the food does not break down correctly. It does not cook correctly. It's not absorbed correctly. So what ends up happening is it causes disease in the rest of your digestive system, and sometimes the stomach too. But the Chinese did figure this out because to them, cold is one of the evil genes, especially in the human body. So in a cold syndrome, according to the Health Preservation and Rehabilitation from the Shanghai College of Traditional Chinese Medicine, these are the symptoms for a cold syndrome. Of course, pale complexion, fatigue, abdominal pain, anxiety and depression, which some people say, wait a minute, cold can actually affect your brain? Yes, it can, because worry affects the spleen and stomach. So yes, it can cause anxiety and depression. It also lowers the body temperature, which of course we call hypothyroidism. Then we have loose stool, diarrhea, edema, nausea. And in Chinese medicine, of course, we're feeling the pulse and looking at the tongue to better diagnose with. So once we have a diagnosis in Chinese medicine, we have, of course, herbs, acupuncture, moxibustion is very good for getting rid of cold syndrome. But one of the things that I like the most in treating cold syndrome is, of course, using what is called Chinese food therapy. Because the best way to expel the cold is to increase the yang energy, and of course that is warm. And first you need to eliminate the ice and the cold before you can really treat the body. Because as long as you are putting ice and cold into your body, it doesn't matter how much yang you put into it, it's not going to make much of an effect. And of course, remember, this is a habit that most Americans do every single day. And if you do quit the ice and the cold, then you see you have warm and hot. Well, what does this mean? Well, you will notice that there are different foods on this list. Because in Chinese food therapy, you will see that each food not only has an energy, okay, if I eat a hot cayenne pepper or jalapeno, oh, obviously it's hot, but they also can have temperature hot, cooked food rather than raw, and it also has energetics. And these are the food's energetics. I mean, most nuts fit under the hot category, and obviously they don't taste hot, but they do generate heat in the body. So if someone has a cold syndrome, you ask them to eliminate ice and then start eating warm or hot foods to help balance the body and bring it back into effect. Because according to this book from Shanghai College of Traditional Chinese Medicine, the best way to treat disease is to prevent it. And for me, this was very important. I love the title acupuncture physician, and I will never give that up, even though I will now have a new title. And the reason is physician means teacher. And to me, that's one of our main jobs as healthcare providers in Chinese medicine, is to teach people how to take care of the body they live in. Because I learned this actually a very long time ago, right after I graduated from school, somebody suggested I read this book. And this book is by Marion Lee, and if you're not familiar with Marion Lee, she was the very first person ever to be licensed to practice Chinese medicine in the United States. It was in Berkeley, California. And I loved it. When I read this book, she's quite entertaining. And she had been practicing Chinese medicine for 20 years. And when she came to this country, she said, oh my God, I'm treating Americans. They're totally different than Chinese people. They don't know how to take care of themselves. They go out in the wind. They overdo everything. Stress is like here. No wonder they're sick. But she had to change the way that she treated because Americans are different than Chinese people. And it's just a cultural thing. I mean, it's not that, well, actually, I do think the Chinese take a whole lot better care of the body. I mean, I'll never forget when one of my first professors, we were so excited he was going to go to Disney World, and we wanted him to meet Winnie the Pooh because all of us had read a book called The Tao of Pooh. And so we wanted him to know about it. And he didn't go. And we were all disappointed. We're like, why didn't you go to Disney World? He says, oh no, too windy. And we're like, what? Too windy? You gotta be kidding. I've gone to Disney World when it's raining sideways. He says, no. Wind bring disease. Well, we hadn't gotten to that part yet. And so now I teach and I tell that story to my patients about sleeping under a ceiling fan, drinking ice cold water. Some of the basics that Chinese don't even think about, the Chinese culture, Americans need to learn because we're harming ourselves because basically we don't realize we live on this planet, we're part of this planet, and Mother Nature affects us. So she talks about this in the book, and of course she says in this book that cold foods slow the metabolism and congest the qi. And she tells a cute little story about she forgot about American cultures and she's on an airplane flying somewhere. And of course the stewardess hands her an iced cold glass of orange juice. And of course she's thirsty, she drinks it. And before she leaves the plane, her eyes are running, her nose is running, she's given herself cold syndrome, minor one, but still, the cold has affected her. So she indulged in our habits and paid for it. Interestingly enough, I actually found a book concerning diet and whether cold and food beverages have harm your digestive system by an MD written in 1905. And in this book, he talks about how if you're going to have iced oysters for an appetizer, have the warm soup so you'll balance your stomach. And if you have ice cream for dessert, by the way, in my personal opinion, that's the worst food on the planet, you also have coffee because, again, it balances the temperature of your stomach. And again, I was very surprised to find anything in Western medicine about the diet, but I did. All right. Of course, now we're into the Western medicine part of this, and you will see that in this, I'm going to use technology because that's how we even know that this works is modern technology. And the modern technology that we're going to do today is the animation of the human digestive system. So of course, this is the first stage of digestion. You can see the saliva mixing with the food, and the food does need to be chewed well, by the way. It's another American habit that's not very good. And the salivary glands, of course, are near the jaw, and they mix with the food, the first chemical that needs to mix with your food to break it down. And then, of course, the food travels down the esophagus. And the esophagus is an incredible muscle system. You can actually swallow upside down. I don't suggest it, but it can because the muscles are that strong. And you see, then it comes into the stomach. And of course, here with the graphics, they show all the stomach enzymes that are coming and mixing with this food to break it down. So you can imagine if this stomach is all of a sudden 60 degrees colder than it's supposed to be, how these digestive juices aren't going to be in the stomach juices, and the food is not going to be broken down to this level that it needs to. Because now it's going to go into the duodenum, which is the first part of the small intestines, and from here you're going to have the pancreatic juices as well as the bile from the liver and the gallbladder further break down the food so that the small intestine can absorb it. Now, talking about your liver, which is one of the largest organs in the human body and part of the digestive system, according to Western medicine, we also have, it produces the bile, and then we have the gallbladder down here. I hope mine looks a little healthier than that one looks. But anyway, and then we have the pancreas. And look how close the pancreas is to the stomach. So again, there's so many digestive enzymes that are produced by this pancreas, and if you've got the stomach too cold, you're going to damage your pancreas and prevent it from doing its job. Now, of course, the food continues to move down the small intestines, and it's absorbed by the villi. Now, the villi takes these very small particles of food and it absorbs into the small intestine, which then takes it directly into the bloodstream. And then from here, of course, it filters through the liver and through the kidneys to help nourish the body. Once the food leaves the small intestine, it goes into the large intestine where fluids are absorbed from the waste material, and then it is turned into fecal matter, and it is hopefully taken out of the body at least once a day. People don't realize you need to take the garbage out of your body at least once a day, and some people prefer 3 times a day. So you can see by this wonderful graphic here that we are one giant chemical reaction, and each stage of digestion has to be at its optimal, which means that it can't be too cold inside, because if it is, it's not going to digest properly. I actually read in Prevention magazine years ago, and you still see this on the internet, that drinking ice water will help you lose weight. Yeah, I wanted to write a scathing article to Prevention magazine. I didn't. But I wasn't the only one that thought this was really silly. Evidently, the University of Washington also thought that they were going to throw a flag on that one, and they actually did research and found out that, yes, you burn 8 calories by warming your stomach up. So, to me, the health risk of drinking cold water, where did this habit come from? Where did we get this terrible custom that all of us take for granted? And people think that you're half nuts about this ice thing, but it does hurt the digestive system. And I was wondering who brought us the habit, and this is the man that did it, Frederick Tudor. Frederick Tudor was in upstate New Hampshire, I believe, and him and his brother were sipping ice-cold lemonade on the veranda of their estate, and that they were bragging on who was the better salesman. And Frederick here said, oh, I'm the better salesman. I'm so good that, see that frozen water on that pond? I can sell it. And that's exactly what he did. He took that ice and he put it in a cooler and he put beverages in it, and he took it to bars and restaurants and said, if you sell this ice cold, you will sell more of it and you will outdo your competition. And he became the ice king. And he gave us something that has damaged millions of people's health without even knowing it. Of course, that is a personal opinion. I have no scientific proof other than my own story. And that is, back when I started school in 1996, I had been sick for 12 years with an array of digestive issues. And I was, of course, being treated in the school clinic. And 9 months later, I wasn't a whole lot better. And I was thinking about quitting school, because if this medicine cannot heal me, how am I going to heal my patients? And then I got into Chinese food therapy class. And I had a bottle of ice, water, on my desk, just like all of you do right now. And my professor said, oh no, very, very bad. And I'm like, why? And she explained it to me. And that is the day I quit ice. And within 2 weeks, my body had healed. And why it had healed is because every single day, I was the ice queen. I had ice in everything. And including stopping off at the 7-Eleven, because I couldn't do ice cream anymore, it made me too sick. So I would stop up every day. And you know those really big Slurpees or ices that 7-Eleven sells? Yeah, that was my drink on the ride home every day from school. I was damaging my body every single day. And no wonder the Chinese medicine couldn't work. But as soon as I quit ice, my body healed in 2 weeks. And the nice thing about it is I'm in my 50s today, and I'm healthier in my 50s than I was in my 30s. And why? It's this. So yes, I am very passionate about ice. I suggest all of you say no to ice. Because when you eat and drink room temperature or warm foods and beverages, you will improve your health. And I thank you very much.